So in this video, I decided to partition it into two. I'm going to talk about some of the most common electrolytes that we test for, potassium and sodium. Now, these electrolytes are often part of a kidney function test, although actually the kidney function is most importantly measured by urea and creatinine. But I think it's important to have some understanding about these electrolytes because they're commonly tested for, though it can be tricky because you can very rapidly go into quite a scientific video, and I'm not trying to sort of teach an approach to diagnostics of this, but perhaps to break down a little bit about where the cause may be. So for that reason, to make these videos not go on for too long, I'm going to split them, and we're going to talk about potassium only in this video, and I'll have a second part where we talk about sodium only. So first thing to mention is that electrolytes that are dissolved, these are generally metal ions like sodium, potassium, and calcium, and others. These have a lot of functions. We can push these ions outside of the cell, extracellular, or we can keep them inside the cell. And they're charged particles. So by having a difference between the number outside and inside the cell, you can have a voltage difference across that cell. So having a voltage difference across a cell is pretty helpful because you can open up a channel in response to a hormone or a drug or a nerve, let in a whole bunch of ions and change the voltage difference, which can have a lot of impacts on that cell. For example, in the heart, it may have an impact on contracting the muscle. So you can use these ion changes for that purpose. So potassium is an ion that is normally inside the cell. So you don't normally see a lot of potassium when you take a blood sample. The levels are controlled to be quite low outside of the cell. When you're taking a test of the serum, you're testing outside the cell contents effectively. But that can lead to some issues when you're testing for potassium. The other thing to mention is that potassium is really tightly controlled, because it's closely related to a lot of processes, in particular the electrical conduction of the heart. So having abnormal levels can be a real problem, and you have to be assessed urgently if the levels are especially high or especially low. I'm going to talk first about high potassium hyperkalemia. Now, if your levels are very, very high, then you may be contacted by a doctor to be brought in to double check that you are well and that your heart is not having any problems in terms of its electrical activity. The issue with this being an ion that's found inside the cell is that there can be fake reasons, false reasons to see a very high level. So issues like having a high level of platelets, having abnormal levels of white cells can interfere with the chemical analysis. Perhaps the blood tube has the wrong kind of reagent to test for high potassium. Sometimes if the sample was quite traumatic, maybe it was a very small vein or a very small needle, or it was left on the lab bench for a long period of time, cells in that intervening period could have bursts. And given that that's where most of the potassium lies, the bursting of the blood cells, hemolysis we call it, leads to a massive rise in potassium that doesn't reflect the potassium level in your body, simply that the potassium from the cells that were taken in the blood tube have burst, or that there's a problem with the analysis. So that's the first thing and most common reason for high potassium. What else could it be? Well, essentially, you either are not getting rid of the potassium properly, or you are taking too much in, or there might be shifts of potassium because it normally sits inside the cell. Perhaps something is drawing it out of the cell. So the intake It could just be that you happen to have maybe you're using low salt, which often is potassium chloride rather than sodium chloride, or perhaps the doctor took the blood sample from an arm where you were having a drip with potassium replacement, so that would give you an abnormally high reading. So exclude intake is the first easy thing to do. Looking at the shifts, potassium can be brought out from the cells if there's a lot of acid being produced, called acidosis or acidemia. The hydrogen ions move with the potassium ions. So if you're very poorly from an infection and have acidosis or other reasons for acid production, that could be pulling out the potassium. And there are some metabolic reasons for potassium not getting into the cells very well. For example, some medications like digoxin and some hormones, like if you're insulin resistant, insulin drives potassium into the cell. And then finally, we'd be looking at, is there a reason why you're not removing it quite so well from the kidneys? And I'm not going to go into enormous detail, but I guess the most common cause would be kidney injury. So the kidneys go into a sudden shutdown, such as an infection. That can cause the potassium to go high. And then there are a range of rarer issues. It could be medication related, and it can be related to certain hormones that have gone wrong within the kidneys that are leaving you not removing enough potassium when you should be. Okay, that's hypokalemia, high potassium. What about if the potassium is especially low? Well, less likely to be a problem of the analysis, because obviously considering this is mainly inside the cell, if the levels are already low, probably genuinely low as opposed to artificially low from a processing problem. So then you're again back to the same three questions. Are you not taking much in? That's pretty uncommon. You don't need a lot of potassium. Are you losing potassium? And are you shifting the potassium somewhere? So if you are losing the potassium, you could be losing this from the kidneys. I'm not going to go into the number of different kidney causes, but you can test to see if there's a lot of potassium loss in the kidneys. Let's just say there are lots of conditions where it does become a little bit complex and medical to discuss all of those in a video of this sort. If your kidneys do not leak lots of potassium, but you still have a low potassium, perhaps you're losing that potassium from other parts of the body. So severe diarrhea, vomiting, other causes for you to be losing the salt. And then if it's not being lost from the body, either from the kidneys or elsewhere, maybe that potassium is being driven into the cells. So the opposite situation to the acidosis is alkalosis. So you have a metabolic process that is causing your bloods to become more alkaline. That will drive the potassium into the cells. And utilization or pushing it into cells for other reasons. So if there's a lot of new manufacture of cells, because potassium is inside the cell, you may see the levels drop. So that could be situations like an aggressive tumor, like a leukemia, but also if you've reversed a cell type that rapidly reproduces. So if you had really bad anemia and then you rapidly fix that with, say, an iron infusion, and all these new red cells are forming, it's driving all that potassium into the cell. And in metabolic situations, if you've been unwell for an operation or in intensive care and haven't eaten for a long time, when you then eat, the insulin that gets released can lead to something called refeeding syndrome, and that can drive the potassium into the cells. So, in essence, potassium, very tightly controlled, mainly stays inside the cell and can be much more serious if it gets out of its tightly controlled numbers, because it can affect the cardiac conduction system. It can be related to your overall state of health, particularly with acidosis and alkalosis. Some metabolic processes can drive it into the cell or pull it out of the cell, or you could be losing it from the kidneys or the gut. I hope you found this video on the first part of the ions, the hyperkalemia, to be relatively easy to follow, and has been some value. I appreciate this is a bit more science-based, but since it's such a common test, I thought it'd be helpful to lay out in a simpler terms why we test for these levels, and perhaps why you might have received a panicked phone call saying, oh, your potassium was really high. But you can see that that doesn't always mean you have a problem. Maybe there was just a technical issue that led to the cells releasing their potassium. So stay tuned for the second part, which will be covering sodium. Thanks.